New at 6:30, a national study released this week shows startling numbers of suicide rates among young children, specifically young black children.
News Channel 5's Jonquil Newland spoke with local experts about this issue and the resources available to families.
Suicide remains one of the leading causes of death for teenagers in Tennessee between the ages of 10 and 19 years old. And when we look deeper into those numbers, we find even more disturbing statistics.
At youth villages in South Nashville, clinicians are busy answering calls for help and assistance.
We see that our call volume pretty drastically increases after kids have been in school for about 6 weeks or so, and then at the end of the school year.
Brittany Farrar is the director of their specialized crisis services and says a recent National Institute of Health study shows younger and younger children are committing suicide, specifically of a certain race.
Specifically for African American children aged 5 to 12, they are roughly 2 times higher risks for suicide rates.
Farrar says a few factors likely play into this. For instance, families in general may not be as aware of both the risk and resources available. Also, younger children don't have a thorough understanding of death or what happens after death. But the biggest factor may be the access to the means to commit suicide.
So it's really important that families secure any weapons, sharps, medications in their home, because the more accessible that means are, a child young like that might make an impulsive decision that then they can't reverse.
She encourages parents and adults to monitor children's social media and behavior patterns.
Maybe it presents more as acting out behaviors or irritability.
If help is needed, these practitioners are just a call away.
Calling doesn't necessarily mean that your child's going to be hospitalized. That can be a big fear. What we want to do is try to help connect with community resources so children can stay in their home.
In Nashville, Jonquil Newland, News Channel 5.
Thanks, Jonquil. The study also found that suicide is more common among white teenagers between the ages of 13 and 17. You can contact Youth Village Crisis Hotline at 866-791-9222. Now, we will show you that number again in just a few minutes. You can also find it on newschannel5.com.